I have a doctor's order to do a push of furosemide, so I'm going to check the order. Okay, I have an order of furosemide, 80 milligrams, IVP now. Available, we have furosemide, 40 milligrams per 4 milliliters. Okay, we're going to start milliliters because that's what we're looking for. And then I have 4 milliliters over 40 milligrams into 80 milligrams. And that's going to be equal to 8 milliliters of furosemide. And that's what we will be pushing. So I'm going to check with our drug guide to see if furosemide is compatible with normal saline that is hanging in the room. And it is compatible, and I will check to see how long we need to give it over, and it says 1 to 2 minutes, and we're going to do 2 minutes because that is the safest way. Okay, so I'm going to perform hand hygiene and pull up my medication. I'm going to clean the top of the vial. Okay, pull back 8 milliliters. And then pull back. Okay. Get rid of air bubbles. Okay. So now we are going to use the scoop method to cap our needle. Okay. And now we're going to label our syringe. We're going to label it with furosemide, 8 milliliters. Okay, and now that we have our syringe labeled, it is the correct amount, the correct drug, and we know how long to push it over and that it is compatible, we can gather our supplies and go into the patient's room. So I'm going to knock on the door, come in, introduce myself, perform hand hygiene. I'm going to do 2 patient identifiers, and it is the right patient, so I'm going to explain the procedure. So what we're going to be doing today is a push of furosemide to get some of that fluid off of you. Okay, so I have already performed hand hygiene, so I can go ahead and put on my gloves. And now that we have our gloves on, I'm assessing my site to make sure that it is patent, and it is patent since we have normal saline running through it continuously. There's no phlebitis, redness, irritation, edema, and the patient reports no pain. So we are safe to go ahead and give. So I'm going to clean the site, and we're going to use the proximal site. Clean with friction. Okay, that is clean. So we're going to take off the needle and connect. Okay. And since this is compatible, we do not have to cut off the drops, the pump, whatever it may be, but we are going to clamp it. I'm going to look at my watch, and I'm going to give it over a 2-minute time. Give a little bit and stop. Still watching my time. Okay, so that has been 2 minutes, so we can unclamp. Take this off. We will dispose of our needle and our syringe in the biohazard box. And then I'm going to still assess my site again to make sure that there's no phlebitis, edema, erythema, pain, and I'm going to make sure that the patient handled the procedure well and she does not report any pain or anything, and she's doing fine. So now I'm going to make sure that my flow rate is readjusted to the correct amount. I'm going to dispose of all my supplies, take my gloves off. I'm going to perform hand hygiene before leaving the room, and I will document.